So the question I have for you is, what led you to working in behavioral health?
I wanted nothing to do with this field. I say that I feel like I grew up really in and out of the system, although that didn't mean incarceration. It meant a lot of alternative placements from the time I was about 13 on. So between outpatient and inpatient and wilderness programs and military schools and boarding schools, charter schools, right? Like all these different things that I did. Because I was, what they would have called back then really a troubled teen. And when I ended up getting sober in my early 20s, I looked back on all the experience and thought, like, what an absolute travesty that I learned about things like anxiety and trauma and connection and some of these things as a sober man. And like, where had this type of support and help and understanding and guidance, where was all of that in all the years of being in and out of all these programs? So really what it did was it made me turn my back even further from behavioral health, because I thought, having come from a family that had some means at the time and had access to resources and access to quality care and things like that, I thought, well, if that's what you get with resources and with money, and like, there's something really wrong with that equation. And a mentor of mine said once, and I've had to come to terms with this, that sometimes you have to fall in love with your purpose. And for me, I know that this is where I'm supposed to be, is in behavioral health and helping to create. In particular, I think this is my form of art, which is entrepreneurship and creating and bringing vision into execution and building businesses in this space. And so really what led me in was being young and not having much going on, and somebody in my life making a recommendation to take an entry-level job at a treatment center as a line staff or a tech, a behavioral health tech, a mental health worker. There's all types of terms where I got introduced to the field and was taking guys to meetings and helping with time management and organization and life skills and things like that. And what I learned really quickly was I loved working with people that were suffering and that were struggling, because I could see myself right in these people. And so really it was an interesting way in that I did not get sober and then decide, really the way I want to dedicate my life now is to trying to help others. I was actually completely comfortable serving the world of the suffering individuals in my own life and not having to professionalize that, which has remained a really important piece of my life. However, the universe definitely had other ideas when it came to what I was supposed to be doing professionally. And so for me, what drew me into it was the recognition of pain and suffering in another individual, and that ability to sit and to hold that space and to be able to look someone else in the eye and to say without using my words that I get it and I understand. And that ability to connect with another human being was, I think, really what led me into the space originally, was being able to look at the impact I could have on another human's life, and being able to at the same time make a living by impacting other human beings that had suffered in a way that I had. And so that was my way in.
Nice.
Hello, Ava Health.